We are live. Good afternoon, everyone. Today's session is going to be really helpful, and it is led by Dr. Divyambi Gai, consultant obstetric and gynecology from Apollo Cradle
I'm
and
not
Children's
able to
Hospital.
hear you.
Can you hear me? Can you hear me?
Hello?
Can you hear me?
Yeah, now I can hear you.
Okay. Uh, Good afternoon, everyone. Today's session is going to be really helpful, and it is led by Dr. Divyambi Gai, consultant obstetric and gynecology from Apollo Cradle and Children's Hospital. She's going to talk about heavy menstrual bleeding, reasons, and management. So stick around until the end and ask us questions if you have any. Doctor, you have the stage.
Thank you. Good afternoon, all. I'm Dr. Divyambigai, consultant obstetrician gynecologist from Apollo Cradle, Karapakam, Chennai. So today I'm going to discuss about heavy menstrual bleeding, what are the reasons for it, and how to manage. So this is a very common occurrence, heavy menstrual bleeding. All women in some or other part of their lifespan, they would have experienced some sort of heavy bleeding. So what are the common reasons for them? So I would like to take this reasons age wise. So when we take the younger age group, that is the adolescent teenagers, that is from the puberty to say age of 20, 21 years, the first 10 years after puberty, the common reasons for heavy menstrual bleeding is, first thing is the onset of period happens when the brain starts releasing the hormones to trigger ovulation, that is the egg release. So once you see the first periods, the next upcoming 12 to 24 months, next 1 to 2 years, that the body takes some time to set that rhythm on rhythm correctly. So that is that we call it as maturation of hypothalamo pituitary ovarian axis. For that maturation of that axis, that is from the brain to the ovary and to the uterus, the coordination to happen, it takes some time. So till then, the periods after the first periods, usually the periods may not be regular for the next 1 year. Some women it will be regular, some girls it will be little irregular. Even if it is irregular, we need not worry much, because that is the thing, like our body is trying to accommodate and set the rhythm. So when there is irregular periods during that time, and a period following a absent period for 1 2 months or 3 months, the flow is to be on the higher side. So the irregular periods with heavy flow is very common in adolescent age group girls. And apart from this, there are situations like the other problems like thyroid dysfunction, which is a very common reason behind cycle irregularity and period flow abnormalities. Like either it will be scanties in some women it may be heavy also. So both extremes can be seen in thyroid dysfunction. And the other common reason we should not forget is that polycystic ovarian syndrome. PCOS is very common in younger age group, in this age group particularly, where they have periods like when phases of no periods followed by heavy flow and prolonged bleeding. All these things are very common in PCOS, polycystic ovarian syndrome. And other thing, this young females, especially when they for the first time when they are menstruating, that is the onset of menarche, that time only they'll come to know about some health issues, medical health conditions like coagulation defects. Coagulation is the blood clotting mechanism. Some defects in the blood clotting mechanism, if at all there in them, that will come to be, they'll come to know about it only after they get the first periods, because their periods will be very, very heavy, because the coagulation, the clotting mechanism in them is weak. That's why the flow is heavy. So especially this young females, that is near around the time of puberty, if they are experiencing heavy blood flow, we have to rule out this bleeding and coagulation disorder issues as well, apart from our routine thyroid and other PCO issues. So that's about the adolescent girls. And we do screen for anemia. Anemia is low hemoglobin. So we do this complete blood count test, and then we screen for anemia. Based on the severity of anemia, treatment will be advised. And coming to the next set of women, like from 21 to 40 years, that is the reproductive age group. So in this reproductive age group women, the common reason for heavy menstrual bleeding is uterine fibroids. Fibroids are benign lumps, that is non-cancerous lumps seen in the uterus. So this fibroid, based on the location and size, it can cause a variety of symptoms. Sometimes a very big fibroid in the outer wall of the uterus doesn't produce any symptoms, but if even if it is a very small fibroid but it is in the inner lining, that is called submucous. This variety of fibroid, even the size is small, they can cause extremely heavy flow, extremely high flow of bleeding during periods, making the women to very severe anemia, getting the blood loss to such an extent that the woman becomes severely anemic. Severely anemic is hemoglobin less than 7. Sometimes we do see women with submucous fibroid ending up with low hemoglobin, where we need to give blood transfusion to improve their hemoglobin. It can go up to that stage also. So whenever you see abnormally heavy flow, that is when you have to definitely meet your gynecologist to do the basic test and try to find out the reasons behind them and then correct them. So that's about fibroids. And another reason for heavy bleeding is adenomyosis. Adenomyosis is the generalized enlargement of the uterus, where we call it as common term is bulky uterus, where women again suffer from heavy bleeding. And then endometrial polyp. Endometrial polyp is a fleshy growth happening inside the inner lining of the uterus. This endometrial polyp can cause heavy flow as well as prolonged bleeding, intermenstrual spotting, that is having bleeding in between two periods also. All these are the common symptoms. And then we do screen for thyroid, PCOS, again in this age group, 20 to 40 years also, we screen for all of that. And the most important thing, this reproductive phase alone, we have to specifically rule out pregnancy. Sometimes this heavy bleeding, that is bleeding with passage of clots, blood clots, and all of that, can be a part of pregnancy related bleeding. Sometimes women with irregular periods may not be aware that they are pregnant. So, whenever the periods are little delayed, they might assume that, okay, every month it is getting delayed, so probably this month also it is just a delay in periods. But they may be pregnant, and then that pregnancy can end up whatever, like with the miscarriage also can cause. Sometimes we do see threatened miscarriage, that is pregnancy is there but then bleeding also can happen along with pregnancy. So these things are very very common because women may not be aware. So in that case, we advise a pregnancy test to rule out whether this heavy menstrual bleeding is related to pregnancy or not related to pregnancy. That is one another differential diagnosis which we have to check for in a younger age group, 20 to 40 years, with irregular periods and heavy flow. And another reason is like apart from uterus, this ovarian cyst. Sometimes this ovarian cyst can secrete a hormone which can cause increase in the thickness of the inner lining of the uterus. That is called thickened endometrium or a common or endometrial hyperplasia. That is whenever the inner lining, that is the endometrial lining, gets thickened, the following period will be the woman will be facing heavy flow in the following period. So these are the reasons, common reasons in 20 to 40 years. And then we move on to 40 to 50 years. So average age of menopause, that is complete cessation of period, is around 50 years. So that preceding 5 to 10 years before menopause, women can have problems like heavy menstrual bleeding. That is called perimenopausal abnormal uterine bleeding. Again, in this age group, the common reasons, apart from this fibroids, polyps, adenomyosis, cyst, and all of that, sometimes just because of the hormonal fluctuations which happens just before menopause, that is the perimenopausal periods per se, can cause heavy bleeding. So we'll again do a scan in this woman to try to assess what is the reason. Sometimes with the scan finding, we couldn't find anything abnormal in the scan. Everything may be normal. In that case, we'll specifically check for the endometrial thickness. And if the endometrial thickness is high, especially in the perimenopausal age group women with thickened endometrium, we would prefer to do a will suggest or recommend to do a biopsy, that is the endometrial biopsy. We can do it as a office procedure where a small thin tube will be inserted into the uterus, and using suction a small part of the endometrium will be taken and sent for histopathological examination to find out what is the reason. Mainly it is actually like a cancer screening. So perimenopausal age group, that is around 40 to 45 to 50 years, with the increased thickness, abnormal thickness in the endometrium, biopsy is advised, just to rule out any underlying pathology related to cancers, because we have to, it's very important to rule out any cancers in this age group women with heavy menstrual bleeding. So cancer, see, it can be a full-fledged cancer, or sometimes we do see precancerous conditions. Precancerous conditions are like endometrial intraepithelial neoplasia, or this endometrial hyperplasia with ATPR. So these are the typical precancerous lesion. If it is not diagnosed on time, can later on progress to full-blown cancer. So this biopsy will be very helpful. First thing is to if at all there is a cancer, to diagnose cancer at a very early stage, where this endometrial or uterine cancer diagnosed at early stage and treated at a very early stage can give 100% cure. So that's very important, and early diagnosis. And second thing is, if at all it is a precancerous condition, then again we can take a decision to prevent its progression to cancer. And third thing is, at least if it is a normal report, we can just reassure the woman, especially in this age group. Women are very much phobic about, they have this fear about cancer. So even if it is a normal report from the biopsy, we can just reassure them. And we have certain other treatment options after ruling out cancer and precancers. We can give a treatment option like non-invasive. Instead of going for a direct surgery, we can do some medical management if the endometrial biopsy says is normal and no cancer or no precancerous conditions at that point of time. So that's about this 45 to 50 years age group with heavy menstrual bleeding. So these are the reasons. So how do we manage? Management is first to do the investigations. The common blood test done for a woman with heavy menstrual bleeding is first and foremost is complete blood count. So one thing I want to insist upon, the symptoms also. Symptoms, heavy menstrual bleeding, that itself is a symptom, but associated with it, what are the symptoms women may have are, one is because of the increased blood loss, chances for anemia. So symptoms related to anemia, like feeling tired, weak, breathlessness, palpitation that is increased in the heartbeat, hair loss, all these things. These are all the common symptoms of anemia. And so we do this complete blood count to check for the hemoglobin. If it is mild anemia, we advise them iron tablets, iron supplements, as well as inform them about iron-rich diet. Iron-rich diet, through diet sources, how can you improve hemoglobin? Are like you have to take diet rich in spinach, the green leafy vegetables, animal proteins, especially mutton liver is a good source of iron, and then figs, dry fruits, figs, dates, and then raisins. And fruits wise, this avocado, berries, all those things are good source of iron. So iron rich diet also can be incorporated in your routine. Apart from that, people with moderate to severe anemia, especially severe anemia, if the hemoglobin is very low, that can have a very bad impact on the general well-being of the woman as well as on the cardiac status. So in that case, we would prefer to do a blood transfusion just to stabilize the women health condition. From then we'll give iron supplements. So it can, this heavy menstrual bleeding, a woman with heavy menstrual bleeding can, if the hemoglobin is very low, she can end up having a blood transfusion also. So that's why I want to insist in this talk, like women with heavy bleeding should not ignore their symptoms. They have to consult the doctor so that they don't complicate their health condition with severe anemia and the requirement of blood transfusion and all of that. So just attend to your symptoms, like how based on the symptoms, meet the doctor and take the necessary management steps to prevent any complications in your general well-being. And apart from this complete blood count, anemia screening and management, the next thing is treating the cause. For example, if a woman, younger adolescent girl with PCO issue having this heavy menstrual bleeding, we try to the main reason behind this thing is hormonal imbalance. So we try to treat the hormonal imbalance by incorporating some lifestyle changes like regular physical activity, that is 30 minutes of walking daily regularly, as well as diet modifications where we advise low carbohydrate, low fat diet. So specifically, diet should be rich in protein, and fresh fruits and fresh vegetables should be incorporated. Cutting down on excessive carbohydrate and sugar intake, and excessive fatty food intake should be avoided. So this about the lifestyle changes for PCOS. Apart from that, we do give medical treatment, that is the hormonal pills to regularize the cycles and the hormonal imbalance. So whenever the cycles are regular, the bleeding may not be that heavy. PCOS women with irregular cycles, once in 2 months, once in 3 months, or once in 4 5 months also we do. So 6 months also people come and say last 6 months I never had period, and this period started after 6 months and never stops, and it's very heavy flow is there. So we do see women coming up like that. So most important thing is PCOS women should make sure that they get periods at least. Normally period happens once in 4 to 5 weeks. For them, at least once in 6 weeks it should happen naturally. If it doesn't happen naturally at the end of 6 weeks, at least they have to take medications to so that period happens within 6 weeks. Okay, so in that way medicines will be helpful to prevent heavy menstrual bleeding in PCOS women. And next is your fibroids. Whenever fibroids are diagnosed through the scan, so next step would be based on the size and the position, we have to plan our management. If it is a very small fibroid causing not much of a impact or anything, generally we do medical management. We have certain medication, non-hormonal tablets, which can be used only during periods just to control your blood loss. That can be tried. But then if the fibroid size is very big and your hemoglobin levels are low because of the heavy flow associated with it, then definitely we have to give a definitive management. Definitive management is surgery for fibroid. So fibroids cannot be managed, or the size cannot be too much. We can't try medicines for fibroids. The mainstay treatment is actually surgery, especially when the woman is associated with very low hemoglobin. The fibroid, whichever causing the problem, should be removed. So that is through surgical management. So we have this. The name of the surgery is myomectomy. We can perform myomectomy through open or through laparoscopically. So laparoscopic myomectomy or open myomectomy would be helpful to remove the fibroid. Thereby, the period issue, the heavy menstrual bleeding problem, can be sorted out. And next is for adenomyosis, there is only a medical management, especially in a very elderly age group who have completed their family, and this adenomyosis not responding to the medicines, then only as a last resort we advise uterus removal, that is the hysterectomy. Next is this endometrial polyp. Polyps are diagnosed through scan, and we advise polypectomy. Polypectomy is the removal of polyp through hysteroscopy. Hysteroscopy is a telescope with camera attached, where we put it inside the uterus and we exactly see where is the fleshy growth, and this the growth is excised through hysteroscopic guidance. And this thing, the polyp will be sent for biopsy to check for any other abnormalities or any cancer changes in the polyp. And so this is about the various reasons and how to manage. And most importantly, there is one condition, as I told you, the scan. Women with heavy menstrual bleeding, we do a scan, everything is normal, uterus is normal, maybe a just bulky uterus and bilateral ovaries, and we don't see any fibroids or any polyps, but still the women continue to bleed. In that case, first we'll do a biopsy as I discussed early to rule out any cancerous changes. And if the report is normal, then see, we are not able to localize any specific reasons. Sometimes it is idiopathic. In that case, one option is there that is called hormone impregnated intrauterine device. So these are the women who are the women who are best candidates for this hormonal intrauterine device. They need not undergo a surgery like removal of the uterus. Instead of that, they can opt for this hormonal intrauterine device insertion. This is nothing but it's like for a contraception we generally advise this copper T. Similar to that, this is again a T-shaped device, but here there won't be any copper here. It will be like a hormone there. So in this T-shaped device, there will be a hormone impregnation will be there, and we insert it inside the uterus and place it, leave it there. So this device can be left inside for 5 years, and this device act only on the uterus, so that the other side effects of taking hormonal pills orally won't be there. And this device causes thinning of the inner lining, so the endometrium won't grow as long as this device is there. So when the endometrial growth is not up to the mark, your periods flow quite naturally it will reduce, because your periods flow is directly related to your endometrial thickness. So whenever the thickness is not forming, then your period flow will come down. Thereby your blood loss will come down. Thereby your hemoglobin will improve, and you will overall well-being of the women is wellness is achieved, because once hemoglobin is normal, you're fine. But when, only if it is low, we feel all the tiredness, weakness, and all of that. So this has a very good beneficial effect. This all hormone impregnated intrauterine device, and over a period of time, slowly the periods, as long as the device is there, some women may not experience periods also, and it serves as a contraception. So one common question asked by most women are like, is it not bad to stop the periods, because when you insert this device, I'm not going to get periods. So that means it is not good for my health. Why should my periods be stopped at an early age before menopause? All these things are very common doubts. But the thing is, see, we are just acting this device acting only on the uterus. So the reduced flow or no periods when the device is inside is actually not a problem. It won't have any impact, and it is not a menopause. It is not a menopause. Menopause is the ovaries, the hormonal production from the ovaries stops, thereby your period stops. Here we are just stopping the periods, which is blood flow which is coming out of the uterus, but we are not doing anything with the ovary. We are not interrupting the ovarian function. So your ovaries will continue to function, meaning every month your ovarian function is okay. So your hormonal support, everything which is given by the ovary will continue. Only your bleeding from the uterus, that part alone will be tackled by this hormone impregnated IUD. And another beneficial effect of this is it gives protection against endometrial cancer. So women with this thickened endometrium, endometrial hyperplasia, all these are the conditions where which can relate to convert to cancer later on. But then when this device is inside, the endometrial lining thickness won't happen. Thereby it protects the woman from endometrial cancer also, and it protects the woman from the surgery, that is the removal of the uterus. If this is not there, then there is no other option. Finally the woman will end up in hysterectomy, that is the removal of the uterus, because after trying all the medicine, if nothing is working out, we have to end up with that option only. That way, to stop the bleeding, just the hysterectomy decision is made when the bleeding is too heavy, that is affecting the woman's health condition. In that case, as a last resort, we advise hysterectomy in a women who have completed their family. So these are the various management options of heavy menstrual bleeding. Yeah, thank you for the session. Any doubts we can discuss.
Doctor, there are no questions. We can end the stream if you want. Doctor, can you hear me?